Well, good afternoon. Very happy to be here, and just I've had the actually good fortune now 2 weeks in a row to be at two very well organized and excellent programs for NMC meetings this week and then last week in Milan. So hats off to everybody in the crew here as well as NMC. I thought excellent programs all the way around. As I said, I'm happy to be here, and one of the reasons that I kind of tried to avoid or slide out of it is that I got to tell you, I haven't run any studies on selective dry cow therapy. When you listen to somebody like Teo talk, they've been living through it. There's been studies here in Canada. There's been, the reason I kind of pushed it on Daryl Needham because they have done several studies in Cornell as well. So here I am as a third party. And actually, I'm not going to dig in a lot of comparing this or that. I'm more going to talk, and it's a little bit going to pick up what Teo was talking about, how are we going to, if we're going to embrace this, or at least consider it, what should we consider on a herd level to, like any other change? What kind of evidence should we direct ourselves to? So, there's me, kind of hanging out on a terrace in a villa overlooking the Adriatic, having a cup of coffee. Yeah, and I know, this was the week before Milan. As you can see, we're hardworking. But that was really a very nice week with my wife and I. I didn't even bring a phone. The wireless didn't work that well. No TV. It was probably one of the most pleasant and tranquil weeks I've had in a long time. From there, we went up from, this is in Puglia, the heel of Italy. We went up to Milan, as I said, a great meeting, and being disconnected from the world for a few days, happened to, and probably stupidly so, turned on, gee, what's been going on in the news? And first of all, I'm kind of shocked as a good American to find out that we are now, we've identified another country as a seat of terrorism or a security risk. That's where I'm standing now. So I've had a little anxiety over this, folks. I have to just full confession. And even more astonishingly, that the weapon of mass destruction that this country is using is cheese and dairy products. And so you can imagine the blood pressure rising. Where do I have to be the week after finding out this news, but standing right in front of a group of dairy producers and veterinarians. So that was a little bit of a surprise, but ladies and gentlemen, as testimony that I'm standing here before you today, I got over my anxiety and here I am. So very nice to be here. But as mentioned also, I got over that level of anxiety, and then what did Dave finally sequester me in to talk about? But selective dry cow therapy, at least the potential for it, which as long as I've been around working with Mastitis and in practice, this means, do we dare actually take on one of the pillars of mastitis control, and that is blanket dry cow therapy? I mean, holy cow. Holy cow. I know, bad joke, okay? All right. You didn't stand here to listen about my vacation. All right. So I'm going to give you a little history lesson, real brief, but at least to give you an idea where I come from on this. And then, as I said, we'll go off on some tangents to at least how could we explore this possibility. At least as far as I could tell, searching through PubMed, roughly about 1966, 67 in there, especially with some of the English work, got picked up at Cornell. The concept of dry cow therapy was first applied and was found to be successful, as you probably well know, in reducing new intermammary infections, IMIs, during the dry period. And actually it was a Canadian study done in the, or at least some of the Canadian work was instrumental in running the clinical trials in helping to develop some of the commercially approved products that came out in the market, big raft of them in the 70s. And then I found this paper kind of interesting myself, this study here in 78. I don't know how you guys do this, but you got a study of all licensed Ontario dairy herds incorporated in the study, but that showed that herds with, in a comparison of herds with higher to lower bulk tank SMAC cell counts, which was a different scale back then to be sure. But what came out, as other studies were showing in the States, but here in Canada, no different, that herds that practice post-milking teat dipping and blanket dry cow therapy were in that group that had lower SMAC cell counts, and yes, happily as a veterinarian, that along with regular veterinary care. So those herds that put together this post-milking teat dipping combination with blanket dry cow therapy were found to reduce mastitis. And this is, as you can see, we're getting to be 40 years ago. My master's, when I left practice in the mid to late 80s, was to go out and do a survey of, we identified herds as our standard bearers. This was below 150,000 cell counts for 12-month average on DHIA, compared to herds that were over 700,000. By the way, when this project started, the legal limit was still 1.5 million, okay? Yes, it's changed a little bit. Oh, do you want me to brag? Should I brag about Michigan? Sure. All right, our state average is 156,000, okay? And that's been going on, we've been below 175 for probably 2 or 3 years. So come on, Quebec, we'll take it on, all right? So, all right, but I'm going to then bash using herd averages as a measure of mastitis, not quality milk later. So hold on to your hats. But in this study, what we found the difference, and we were looking at things such as selenium and milking equipment use and all sorts of things, but what came through as the two major differences, well, some differences. First of all, the difference between high and low cell count herds, as you might well guess, is the prevalence of infection. And this is back in the day when we had obviously a lot more strep bag, as you can see in these herds, and it wasn't hard to find herds at 700,000. A quarter of the cows infected with strep bag, large proportion Staph aureus, some of the non-ag strep, as compared to herds that, as we all know, who've controlled those. And what were the behavioral things, the big difference between these two groups of herds? Very little, but except for teat dipping, post-milking teat dipping, and blanket dry cow therapy. All right? So you can understand in this environment, at least as it was back some years ago, why, and if there's this experience, I've had this passion for blanket dry cow therapy for some time. However, and I'm not going to spend a lot of time on this, Teo did a great job. We watch what's going on over in the EU. We in cells, and I forgive my ignorance, but I don't know what on the Canadian side, but we've gone through the veterinary feed directive. Is that something similar? You guys doing that? Where the antibiotics feed now have to be prescription. And we no longer can feed or put antibiotics in feed as a growth promotant either, okay? So that's come down this past year. Over-the-counter drugs, that is the type of drugs that can be purchased at a tractor supply store, as we call them, or farm and fleet. Those are going by the wayside, so no more even horse owners and going out and buying penicillin. This is creating a real crisis in some areas that don't have good representation of veterinarians, some of the rural areas. And, as we're here to talk about today, dry cow therapy, because certainly in the States, as everywhere else, you don't have to look very hard in some food shelves, and you're going to see things like antibiotic-free eggs. You can see it on menus in the restaurants, grass-fed beef. The consumers are increasingly aware, or at least interested, on the source of their food and how the animals are raised. Teo, I think, explained that very well. And so here we are today, and I showed you all that briefly, all that information of why we love blanket dry cow therapy, but we are in a different world. That's a reality. The dairy industry has changed markedly in that 30 years since I've left practice, and a variety of things. The sophistication and technology, who knows with robot milking, as during our short course yesterday, we were talking about how do we work with, how do we take some of this information, get in a parlor and work with training of employees. That's another whole adventure that we're into that we weren't into some time ago. We have internal teat sealants. I think, after listening to Sandra, we're starting to get the idea of what is good housing, and we're wrestling with bedding and all this. But certainly a lot different. And as Sandra said, we're really living on many farms in a reality now that we're not really dealing with the prototypical contagious pathogens. And so it is more of an environmental mastitis world, at least what we'd call environmental mastitis. And therefore, perhaps the rules have changed, because indeed, when you look at most of the intermammary products that are out there, at least I'll say available in the US, you seem to have a more extensive list in EU and perhaps in Canada, it's pretty much directed to gram-positive, and a lot of them were thinking strep bag and Staph aureus in mind. So we are in a different world, and maybe what was good back in Pennsylvania 30 years ago has to be re-examined, at least from a more modern dairy operation. And so we should probably spend more time talking about the environment of the cows than what kind of tubes we're putting up in their quarters. And I absolutely agree, prevention is the key before we start popping antibiotics in a cow, be they a dry cow, lactating cow, any way you look at it. So, and we also have a reality of things like mycoplasma mastitis. It's kind of swept through Michigan over the years. We're now in a lower, it seems to run its course in many herds and then kind of just gets in a balance, but not much we're going to put in a quarter of a cow, in my pretty strong opinion, is going to affect the outcome of this type of infection either, all right? So we are just dealing with, again, a different reality. So I'm going to take just a little different track, and why I am totally buy into that we want to reduce antibiotics. We are responsible to the public, especially in a food-producing animal like a dairy cow, to do our role in mitigating antimicrobial resistance. I really think if you at least want to talk to a typical dairy producer, the core reasons that we have to get across, if this is going to be accepted on a greater or a more widespread basis, is going to be that we have to get across that if we're going to consider selective dry cow therapy, it's because we've had change in herd demographics, herd size. We have a lower, or at least let's just say we've had a shift in the prevalence of the pathogens in many dairy herds over the years. We've had advances in milking systems. I think it's fair to say we can milk out cows, at least potentially, better than we did before. If done right again, we certainly have opportunities. We understand what improved housing requirements are for cows than 30, 35 years ago. And I will tell you, I'm a great believer in internal sealants. And I was interested in that last question because, or one of the questions to Teo, because I think if we're talking selective dry cow therapy, this part of this has to be a discussion, are you going to use selective, or I'm sorry, internal teat sealants as well? So, is blanket dry cow therapy obsolete? Good review, Canadian review by Dufour, just not too long ago, in which they put a kind of a analysis of all sorts of studies over a number of years. And I found, among other things, that blanket dry cow therapy was still associated, not cause and effect, but associated with lower SMAC cell counts. Now, as I understand from reading that article, that they went back in the literature all the way back to 1979. And so maybe a critique would say, hey, Erskine, but yeah, you know, you're dealing with studies that went way back when we had a lot of contagious mastitis. And so maybe it had been different had the reports not gone back that far. I don't know. All right. But to that point, we did have a relatively recent survey of 3 states, over 600 dairies. This large USDA-funded project that we had been running for the last 5 or 6 years. And when we looked at what were factors that were associated, I say associated with lower milk tank SMAC cell counts, on that list was blanket dry cow therapy, use of internal sealants, not using water, okay, in milking prep, and one that certainly got our attention, and we've gone down this rabbit hole with employee training, those farmers who ensure strict compliance of milking protocols with their employees tend to have lower SMAC cell counts as well. Now, teat dipping didn't end up on this list, and you're saying, well, where is it? But frankly, over 95% of the herds, or at least they told us, that they were post-milking teat dipping, so it's really hard to discern any kind of effect on that when there's that much acceptance of that behavior, okay? But relatively recent survey, and I want to point out these are herds, now this is across the whole study, but over 600 herds, their average SMAC cell count, bulk tank SMAC cell count was 191,000. So, you know, one would say, well, gee, they're already doing pretty well. How can things like blanket dry cow therapy still have an impact? But in this, at least in this study, it did. So, you know, do we throw out this blanket dry cow therapy automatically? So I'm going to kind of talk a little bit about some reflections or observations on selective dry cow therapy. As I said, I haven't run a study. I'm going to refer to a couple studies, but I'm not going to go through a lot of these studies in detail. Like, well, this one said this one that. I want to pick what I think are the important things to note of, one, how do you identify the cows you want to treat? That's instrumental. How are you going to monitor the impact if you, and this goes for any change that you do on a dairy farm. And how are we going to, so if you want to make that choice, selective dry cow therapy or anything you do, how do you monitor the impact to see if it really, okay, what does it cost you or not? And I know Teo certainly touched on that. And then one thing that we can't let go, this could be good or bad depending upon the employees, but how are we going to assure that the quality control, I will say, of the procedures or the protocols that are done? Okay, any change, that means there's a change in protocols, and then how are we going to make sure that you're staying to them? So here is a study, and it was a couple years ago, but in this study, just to get the ball rolling, the idea of this selection criteria. And when you look at the selection criteria in this, they were trying different, almost like an algorithm of, well, if we identify cows based on a cell count of 200,000 for the last 3 test dates, or what if we tried 100,000, or we used a CMT or clinical mastitis history, or a combination thereof, and then they matched it to what the cow's infection status was. But interestingly, when you look at the sensitivity and specificity, and this has always been a problem with cell counts, but it's fairly good, fairly robust, not perfect, but the best accuracy that they could get with these kind of combinations came up when they said, okay, we're going to select cows who had 3 last tests at 100,000 or less, okay? And I believe they also had, threw in there as well, lactation. But you can see that the accuracy was between 70 and 80%. So no matter what you do, at least if you're just going to use cell count, we're going to come back to that in a second, you're not going to ever probably hit 100%. There'll be some cows with low cell counts who are truly infected, and there'll be some cows with high cell counts that at the time are not infected. So that's part of what we have to accept. With Meg Cameron, the Canadian study, I think, brought in a couple other, so we're thinking cell count. What I liked about this study that brought in the concept of, well, what about maybe before we jump in and do this, there should also be a selection of the herd that we really want to try this in. In this case, they had a criteria of only herds that had already cut below 250,000. Maybe it should be below 200,000. Maybe it should be 300,000. But at least some awareness that there is a big difference in herds, it was mentioned before, and big difference in herds in the ability to, shall we say, comply or at least prosecute any kind of change that you want to bring into them. Also, they used a criteria of low SMAC cell count cows would be the good candidates. In this study, and I kind of lean this way, they infused these cows still with internal teat sealant. And what I thought was a more aggressive approach and probably added a great deal of accuracy and I think benefit to the outcome was that they also instituted a culture system on those cows that they had pre-selected based on cell count, which then added another layer of identification or assurance that these cows could or could not have been infected and thus should or should not be treated. So this is a real rough table, but just to kind of show you how some of the variable results, it's not so much getting lost in the weeds in my situation or my perspective of, well, these guys did this and these folks did this and therefore they had this result. I think what you want to step back and look at is that the important thing is that no matter what you choose in a herd to do, you're going to need a selection process for those cows. It is probably, and should probably, at least to save a lot of labor and time, use some measure of SMAC cell count. That's the easiest way to make the initial cut. Now, whether it should be 1 before drying off or 2 or what level you pick, that's going to, I think, depend on the herd. But I think we'd agree it's probably going to be at least 200,000 or less for an individual cow. Also, you have to, we're going to get into this, but you have to be aware of what the new infection rate is during the dry period and the cure rate. Now again, there's been various results depending on what the criteria was and whether or not culture was used. However, if you do look at the Canadian study, okay, number 3 here, that in that situation, and off the top of my head, I can't remember how many herds were involved, but by doing their rather, I'll say, rigorous selection process, that they did not see, or let's put it this way, selective dry cow therapy worked. They didn't see any situation where there was any difference between the treated and non-treated cows, between cure rate, intermammary infection, cell count and lactation, or even probably most importantly, in my opinion, when we get to talk about drug use, and we'll come back to this, the clinical mastitis and early lactation. And then, previously mentioned Dr. Neidem and his group in Cornell, they just had a recent article where they're talking about developing an algorithm for individual herds, whereas just a mix and match of they use culture and SMAC cell count and maybe clinical mastitis history. So all this is out there in the table. And I am not going to stand here in front of you and say, this is the thing, this is the best study, and this clearly shows this is what you should do for this herd. I think, again, more importantly, you need to develop a system of selection. It's probably going to include a combination of these sorts of things. And I will stick out one bias, and that is, I would be a little nervous going selective dry cow therapy without internal sealing, but that's a bias, okay? So, kind of sum it up where we're at so far. Selective dry cow therapy, maybe, maybe not. Full disclosure, the dairy world has changed on us. It's good to rethink dogma, even an old guy like me. And probably we're talking about rethinking dogma in herds that have proved to be good managers, probably not the ones who are a little more marginal, okay, with their employee training or getting things staying to task or treatment protocols, milking protocols. You're going to have a plan to select cows. And the evidence would best suggest, if you do a quick lit search, that is going to include probably, at least to me, some measure of SMAC cell count. Culture looks like it'd be probably one of the best ways to go, at least for accuracy. And it probably wouldn't be bad to throw in a little clinical history as well. You don't want that cow who had clinical mastitis 2 or 3 times during the past lactation. And as I said, at least from some of the studies, it seems that some of the best results have been obtained when the internal teat sealants are used in combination with the selective therapy. Okay, so all that bragging about cell counts, right? And I want to be clear on this, absolutely crystal clear. I am not going to say there is certainly a good association between bulk tank SMAC cell count and mastitis prevalence. But it's robust, but not perfect. Now, quality of milk that I put on my cereal in the morning, sure, I'd rather have 100,000 cell count milk any day. But I will just push some buttons and say, yeah, bulk tank SMAC cell counts or herd average SMAC cell counts with DHA are great indicator of the quality of the milk being shipped from the farm, but mastitis, it's a crude measure. And this kind of came up, whoever asked about the culling. So our perceptions of herd milk quality, if you go to a typical, at least I'll talk my perceptions in the state anyway, in the States, everybody's ramped up about bulk tank max cell counts. Depending on the co-op, although they're dwindling given the milk price, you may receive a bonus for shipping lower and lower SMAC cell count milk, okay, a premium bonus. But you talk to many herd managers, and their perception is about the cows that have clinical mastitis, or those chronic high cell count cows that only make up about 2 or 3% of the infected cows who are contributing, well, they're 2 or 3% of the herd, and they're contributing about 30% of the cell count, bulk tank SMAC cell count, an oversized role. And they're the ones who are chronic, and they're tired of bunking around with them. And so, in my experience, many herd managers or owners spend a lot of time, their mastitis program ends up being sucked into the rabbit hole of dealing with this 2 or 3% problem cows and not the bigger picture. Why? Because our cell count's 175,000, no problem here, okay? And of course, the reality is, depends on the herd, how much subclinical infections do they have going on? And that, in many herds, and I know in the US it's getting, it's declining because the problem is, we are going through a decrease. Part of it is driven by the low milk price, but this has been going on for some time. Many of our dairy producers, I'm afraid to say, and I know things are better in Ontario and probably Quebec, that many of our dairy producers just, for some reason, don't see a value in collecting individual cell count information anymore. And I think it's a mistake. Nonetheless, this now slaps us right in the face because when we start talking about selecting cows for dry cow therapy and making an intelligent way to do it, if you don't have individual cell count information, that's going to be a barrier right off the gate. The other thing I will tell you is that on that same survey I mentioned earlier, that 3-state survey, unfortunately, when we asked the question, we asked the question like, well, how often do you use culture, milk samples, for either A, when you have a clinical mastitis case, or therapeutic decisions? And in the response, less than 15% of the herds told us always or usually. That is 85% of our dairy farmers, and it might even be less in other areas, told us that we'll even culture a cow. And now I'm thinking, well, think of the Canadian study where you were culturing cows at dry off and trying to help identify these infected cows. We can't get out of the gate to even get most of our producers to culture cows for a clinical case. And now we're going to ask them, and I'm not saying this is good behavior, this is my reality. So we have decreasing use of individual cell counts and a reluctance to do culture. I mean, there are herds out there who do on-farm culture, but this is going to be a real barrier for us. It kind of worries me. So here's an example, too, of why I get a little jaded over a herd average cell count. Here's a herd. You can see this is from the last 6 or 7 tests on DHIA. This is the herd average. Proportion of cows 0 to 3, so we'd call them not infected. And then over here, various linear score categories. And if you look at this month, for instance, and I hear this all the time, oh, I changed teat dips and my cell count went down. Look at this, you know, from 330, I had a drop of 50,000 in the cell count. Or I changed liners, or I did this, all right? And I'm all for it, but at the same time, I like to go to this column and point out to these folks that, well, that's funny because the proportion of cows who have a low cell count actually declined while your herd average cell count went down, meaning you have more infected cows when your cell count went down. How's that magic work? That magic works because, again, remember, we're dealing with these really heavy hitters on the other end, and the musical chairs that we play by some of these really high cell count cows coming and going or being culled or drying off 3/4, that has a huge impact on a herd average. But as you can see, it doesn't really Okay, so despite this 50,000 decrease, we had a 5% increase in the number of infected cows. Here's data. We have 134 Michigan dairy farms. Herd average SMAG cell count on left. Percent cows new infections, it will define that from subclinical. Truly, we didn't culture them, but this would be based on DHI data of being linear score 4 or greater, 200,000 or greater. So we use that as our measure. And if you look at, here's some herds who are at average, Michigan average, or below, and we box them out, and look at the scope of new infections among those herds that we'd say, wow, 150,000, why are we even bothering with mastitis in this herd? We have herds, true to form, low systematic cell count average, and very low new infection rate. By the way, we think that 4% or 5% and less is good. The top 25% in Michigan herds will get 4.5% new infections or less. However, how would you like to be the farm at 12 or 15% of your cows infected every month? Now they're both shipping, or both have the same herd average, but who's working harder to keep that low cell count in the tank? The people at 2 or 3% of their cows each month, or those who are 14 or 15? So herd average in this day and time, at least in the States to me, can really belie how much mastitis we have going on. Because, as the gentleman asked, we have culling. And boy, are we culling cows in the US. And then we buy some more. And don't we, Roger? Yeah. And then we have 3/4 cows. My rough survey from the project we've been in all these parlors the last few years, at least 5% of the cows are now 3/4 milked in most parlors in the US. I don't know what goes on in Ontario and Quebec, other places in Canada, but that can certainly mask, gee, I got a new infection, well, and I'm not advocating we treat these chronic cows, but they have this. We've got treated cows, we have cows drying off, we have cull cows. So the nature, or to use that herd average cell count as a measure of mastitis in your herd, I get a little squeamish. So here's an example, and tell you this is perfect because we also like to follow. If I were advising somebody, should we go to selective dry cow therapy? I would say, all right, let's track, among other things, clinical mastitis after calving and all that. Let's track individual SMAC cell count change during the dry period. You're looking at, as a cow to be a new infection, quote unquote, she would have had to have below a 4 at her last DHI test before she dried off, and then have above a 4, 200,000, in her first test after calving. Okay, she had a change during the dry period. Now we can argue if she really was infected and all that, but at least it's a standard that we use across herds. So there'll be no first lactation animals in this score. But here's a herd, I want to point out that their herd cell count was 190,000. We're at April 15. They got a new herd manager who didn't realize when they used the teat sealant that you had to squeeze the top of the teat to keep the teat sealant from going up into the udder. Okay, didn't make much of a seal then. And what happened, interestingly, over the corresponding year, we went from 15% of the cows who had a high cell count, or new high cell count, well over 20%. Then we had our instruction time, and then we went back down. If you want to bring in select dry cow therapy, you need to be, among other things, aware of what is going on this number each and every month. Another similar situation, here's a herd. We're looking now at both the lactation 1 and all cows who had a high SMAC cell count at first test, but again, that black line, okay? This is what's going on with the change, if you will, or cows who've had a new infection based on cell count over the dry period. And in this herd example, they instituted a new dry cow barn and internal teat sealant in the summer of 15. I can't parse out which is which and which helped. No, it's not controlled, but it's pretty impressive when you cut more than half the proportion of cows who have that high cell count change during a dry period. What I'm suggesting is that, and I'm happy Teo brought it up, is that I would really be nervous if I didn't have these numbers and I then take the plunge into selective dry cow therapy in a herd, and if I don't know how this number changed over the 6 or 12 months I did that, I don't know where you're at. Okay, and mind you, both these herds, okay, look at the, the cell counts that they had, like before and after. And incidentally, the last herd, if you saw that, they were actually, okay, they had a change that was it actually went up. But notice, we would look at these herds just from a herd average cell count or bulk tank and say, yeah, they're fine. It's not changing. I'm not having any change in my new infection rate over the dry period. Yeah, you are. But you're not going to pick it up in herd average. At least in my opinion. Okay, that's a breakdown. If you want to know what's good, at least from Michigan standards, top 25% of the herds, they keep their dry cow infection rate, such as we described it, less than 11 or 12%. There's our median. You start getting out here, and Teo, I saw you had some that you were tracking at 25%. Is that right? Yeah, that's quite a high level for us. I think those herds have an issue. Okay. Talk about, we're not going to spend much time, but the quality control of protocols. Maybe one of the advantages of going selective dry cow therapy, and I don't say this in jest, is maybe we're just rubbing and we're infusing teats less because somebody's got to properly clean a teat, and the more times we jag a tube up in a quarter, the more risk for infection. Good study in Canada some years ago that internal teat sealant use was associated with prototheca infections. That always intrigued me. But if this isn't done properly, maybe it's not such a bad idea to go selective. I already talked about the protocols of making sure you're using internal teat sealant properly. We've got to do a good job of all the things we know about, Sanders said, hey, we can't forget the dry cows and transition cows as well when it comes to bedding. Okay, so why should I care, all right? Iconic movie, folks, if you've never seen Thelma and Louise, okay? So why should I care about all this stuff? And, what does it mean? Well, to just bring this up or finish up a little bit, there have been good evidence, and more recent evidence, I don't even have in slides, but basically cows who start their lactation infected are going to lose money. And the longer they're infected, that is the earlier in lactation they get infected, the more money you lose. Here's a study of 166,000 cows, and Mark Kirkpatrick actually presented the NMC a couple years ago. Basically, you're looking at 700 kilogram difference, 3 times more likely to have clinical mastitis, 3 times more likely to be removed by 60 days, okay? And even in a 15 days increase in days open, just for fun. That's real money, and so what I'm telling you is that what this study showed, that each cow who starts off with a high cell count is going to bring in some real losses. Clinical mastitis, the study came out a year or two ago. To surprise, but a cow in early lactation is going to have greater losses than a cow later in lactation, and so we many times throughout this $200 per case number, you start looking at cows in the first 30 days of milk, and it's probably double that. So the consequences, why should I care if we choose to go selective dry cow therapy and if we aren't careful to monitor things like clinical mastitis, changes in cell count over the dry period, and we aren't really staying on top of that, and we're just relying on bulk tank max cell count, you might really be missing an opportunity here. All right, final thoughts. And Teo, we should have a beer after this and talk about this, but so I've had Herman Barkema, he was an advisor in our committee, and talked to Pam Ruig a lot more now. She's at Michigan State. But one of the things we did on our project, and Ernest Hoving over in Penn State, is that we put these bins out on the farms and just asked people to dump anything they use antibiotic-wise into the bins. And then we went dumpster diving and started counting. I won't give you all the details of that, but just this really got me thinking about this, what is this antibiotic use? And how do we quantify it? And I'm well aware of this, the daily defined dose. And that's the thing that, just to be contrarian, I want to finish up with. I looked at the Dutch study, and at least in this study, they were looking at, and I think Teo mentioned this, but there was this 85% reduction in antibiotic use based on a daily defined dose. And Teo, if I didn't get it wrong, I think you guys are counting each tube was 1 daily dose. But there was the comment, and I'm not saying this is going to happen for every herd that uses selective dry cow therapy, it sure didn't in the Canadian experience, that there was a nearly 2-fold higher use in systemic use after calving in the no dry cow treated cows. Now, this is more an exercise to me of math, but this is why I'm trying to wrestle, especially as we got all these bin numbers that now we got all this data, and how are we going to quantify this? So if, for instance, you put in a Tomorrow tube, American cephalosporin, do you call it Tomorrow here too? No. Okay. But 300 milligrams a tube, that's 1.2 grams total drug, and that was counted as 4 daily defined doses. So, and then of course, if you don't treat that cow, you've got 4 reductions, if you will, in doses on the ledger. However, what if that cow, after calving, pops with a clinical mastitis? You elect to treat her, especially if she's severe, with systemic antibiotics, and let's say you use something like tetracycline, oxytet. Standard dose we might use, 11 mg per kg. That's 7 grams. And that also, in the world of ADDs, is 1 daily defined dose. And if you treat that cow 3 days, which I would recommend a minimum, maybe 5, because it is a time-dependent inhibitor, that you might just even 3 days in that cow use 21 grams of total antibiotic. Now it's true, and yet that's still a reduction on an ADD basis, okay, of 33%. I've used 33% less drug in ADD, yet I used almost tenfold on a per mass basis of antibiotic. Now, is that a little against the current? You bet. But I think we should reflect on this. So all the more important that you really want to make sure that if you're going selective dry cow therapy, you do not have an increase in clinical mastitis that is leading to more systemic drug use after calving. Also, who's more likely, I think Teo mentioned this, but who's more likely to end up going to the meat market and be a residue risk? That dry cow, who you kind of have a planned event and she's going to calve, well, we hope 45, 60 days later, or that cow that just calved, she looks like a train wreck, you try to treat her and there you are a week or 2 later and she isn't doing well, not milking, time for her to go. I know on the US side, cull dairy cows still are one of the top offenders, even though it's been coming down, for residue risks in meat. All right, so to sum it up, sure, I'm all in. We can try selective dry cow therapy. I think it's a reasonable approach. I get a little worried over some of our managers making choices about culture and smack cell count they shouldn't be making. But if you can, I think you can work it out between the folks on a farm, veterinarians, and the producers to come up with an algorithm that works for you. It's not going to be the same, I'm sure. And certainly there's opportunities. Good thing from the use of antibiotic use. Or declining antibiotic use, absolutely. You got to monitor the impact. And please, I don't think it's going to be just tell me about herd average smack cell count. And you got to make sure whatever new protocols you have, whatever they may be with your dry cow therapy program, someone's got to get there and make sure they're being followed. Okay. I definitely think this has been the best, most informative talk ever with the largest, most beautiful audience in history, Bigley. Okay? Thank you.